An intracranial aneurysm or saccular aneurysm is a small little balloon or berry that forms off the side of an artery up in the brain tissue. Now, intracranial aneurysms are extremely common. Actually, about 2% of the population has a brain aneurysm. And so that means that about 6 million people in the United States alone have a brain aneurysm. Now, these can be diagnosed in many different ways, but oftentimes they're detected on a CAT scan or MRI scan that's done for reasons completely unrelated to the aneurysm. That somebody may present with headaches or dizziness or some unrelated symptoms, and a CT scan or MRI scan may well show this small aneurysm that is present. In other people, aneurysms can be detected after it's ruptured. That is, that this small little balloon has burst. And what occurs at that point is blood spills into the brain tissue, causing what's called a subarachnoid hemorrhage. It's a certain type of stroke. It's a very serious type of stroke. Now, when an aneurysm is detected prior to rupture on a CAT scan or MRI scan, the question arises regarding what should we do about it? Do we need to treat it in some specific way to try to prevent a future rupture? There are many different factors that we take into account in determining whether an aneurysm should be treated or whether it can be safely left alone. And these factors include where the aneurysm is located in the brain tissue, how large the aneurysm is, and a whole variety of other factors, both related to the aneurysm and also related to the patient as well. We ask about the family history, the patient's medical history, their overall health status, and then we make a decision regarding a recommendation of treatment. Now, the treatments that exist for brain aneurysms are multiple. There is a surgical treatment in which a neurosurgeon actually goes in and puts a little tiny metallic clip across the base of the aneurysm and treats it in that way. Now, more recently, there have been non-surgical approaches developed as well, and these are called endovascular treatments, meaning from within the artery. And in that approach, a small plastic catheter or tube is put into an artery in the groin area and then advanced all the way up into the brain tissue, all the way up into the aneurysm. And small platinum coils, little tiny pigtails if you will, are placed in the aneurysm and treated in that way. And so again, that is called coiling. There are other treatments that exist via an endovascular route as well, again, coming from that catheter that's placed within the aneurysm. And so there are a whole number of treatments that are considered depending on where the aneurysm is located and the size and other factors related to the aneurysm appearance. Now, another treatment option is for the aneurysm to be left alone and to control what we call the risk factors for aneurysm growth or rupture. And those risk factors include cigarette smoking and high blood pressure. And so we'll treat those factors as aggressively as we can and help a patient to quit smoking if at all possible. Now, if an aneurysm is left alone, we may well repeat scans over the course of time to make sure that the aneurysm isn't growing. We may use CAT scan or may use MRI scan to follow the aneurysm over the course of many years to be sure that the aneurysm isn't growing. And so we can readily see a patient and perform those tests and be sure that the aneurysm is stable in size. Now, people often wonder, again, are there specific factors related to aneurysm formation? And the most important issues are cigarette smoking and high blood pressure. Both of those appear to be factors for aneurysm formation. It appears that women are more likely than men to form unruptured aneurysms for reasons that we're continuing to try to clarify but aren't entirely clear at this point in time. Family history of aneurysm is also important, and about 20% of aneurysms that we see report that there's a family history either of aneurysm or of aneurysm rupture, and so that is another important factor that we take into account. So if we see someone who does have a strong family history, we may well counsel them that their first-degree relatives, that is parents, siblings, and children, should be screened with MRI or CT scanning to assess for the presence of a brain aneurysm. Now, here at Mayo, we're interested in aneurysm research in a variety of areas, both in terms of aneurysm detection, the imaging, that is MRI scan and CT scan imaging for brain aneurysm. We're interested in family history of aneurysm, in other words, familial aneurysm and the genetics of brain aneurysms. And we're also interested in assessing the details of aneurysms that predict the future risk of rupture. And by knowing those particular details, those specific factors that increase the risk of rupture in the future, we may well be able to counsel our patients better. So there's been a tremendous amount of research performed here over the course of time to try and define which aneurysms that are detected prior to rupture, which ones can be safely left alone, and which ones need to be treated. And then finally, in collaboration with our neurosurgical and neuroradiology colleagues, we continue to assess the best treatments for aneurysms in a wide spectrum of locations and sizes. And so, again, our interests in aneurysm really do run the spectrum from formation to predicting growth and rupture to optimal treatment, as well as epidemiology. Now, in the near future, on August 21st, Mayo will be participating in an event with the Joe Niekro Foundation and the Minnesota Twins. The Joe Niekro Foundation was formed several years ago after a very highly regarded baseball player, Joe Niekro, had a fatal subarachnoid hemorrhage from a brain aneurysm. And his daughter, Natalie Niekro, formed the Joe Niekro Foundation with the goal being to study brain aneurysms in a whole variety of ways, with the hope of being able to better detect, treat, and overall manage aneurysms in a better way than what we could previously.